All right, so this is going to be lecture number 3. You should be listening to hierarchical theory after you've listened to reflex theory. And so this is the next one that we'll discuss. And again, hierarchical theory is an older theory. It was used as the basis for many of the interventions that were done for physical therapy in the 50s, 60s, and 70s. And while these interventions may still be very useful, we may want to think about them utilizing a more modern theory instead of the hierarchical theory. So let's move on. Pull out your spreadsheet, your table, and start thinking about how this theory would affect what we're doing in the clinic as we go through the next couple of slides. All right, so when we talk about the development of hierarchical theory, unlike reflex theory that was really been credited to Sir Charles Sherrington, hierarchical theory actually has been credited the development of it to a variety of researchers. So these are a list of some that are believed to have heavily contributed to the development of hierarchical theory, the ones that we're going to discuss now. So we have 6 here listed. The first one is Jackson. Jackson was actually an English physician who theorized that the brain was organized in a hierarchical fashion, so that higher centers of the brain actually controlled or took over control for lower centers of the brain, and that these higher centers, when available and well developed, were actually always in control. And so it's a very top-down approach to the brain and how it works. Magnus in 1920s, he actually was talking about and took a little bit of reflex theory and combined it into this hierarchical idea where he believed that reflexes were actually controlled by lower centers of the brain or activated by lower centers of the brain. And when higher centers took over through development, they were then active. And that what we saw in people who had neurological damage, when they had a higher center damage, we would begin to see reflexive control simply because the lower centers were then the only thing available to work because higher centers were damaged. We also see some work by Schaltenbrand in 1928. And he looked at mobility by describing the appearance and disappearance of hierarchical reflexes. So again, he's talking about as people develop and change, particularly during childhood, that they actually learn to walk and to move based on the appearance and disappearance of hierarchical reflexes. So these reflexes that were observed early in life would then disappear as the cortex took over, and then we would see improvements or changes in motor control. Weiss in 1938 described the development of equilibrium reflexes in children. So he actually suggested that as a child learned to control their posture and demonstrate equilibrium responses, he actually labeled these as reflexes and suggested that these were reflexes that then developed, but in a hierarchical fashion. So they didn't actually have them when they were young. As they developed, they developed, those reflexes developed. Gazelle and McGraw in the 1940s, they were very much followed this hierarchical theory as they described in detail maturation of gross motor and fine motor skills in children. They got down to discussing over 100 steps in the development of picking up a pellet, reaching for a pellet, and described it very much that these changes occurred as more myelination and higher centers took over for lower centers. So for every small little change and improvement in the development of the cerebral cortex, you demonstrated a change in either the fine or gross motor development that you observed in children. And these two theories, reflexive and hierarchical theories, were combined when we're thinking about pediatric physical therapy, particularly. They were combined to suggest that the central nervous system maturation drives and actually was the reason that we saw changes in motor development in children. All right, so if we talk about some of the limitations and clinical implications for hierarchical theory, again, a huge limitations is if higher centers are taking over for lower centers, then they can't explain why we'll actually see instances of what they would consider reflexive behavior or motor output that looks similar to some of the reflexes that they identified, and why that dominates then in normal adults. As far as some of those theories that reflex and hierarchical theory were built on, Brunstrom's theories, where she discussed the progression from abnormal reflexes observed in patients who had neurological reflexes, and as they improved, you'd see more movement and improvements of higher centers taking over for those lower centers. Also, if you think about NDT, neurodevelopmental treatment that was discovered or taught by the Bobass, they discussed abnormal postural reflex activity and suggested that this limited the development of normal movement in children. So throughout their intervention, what you're trying to do is facilitate higher centers to activate and then inhibiting lower centers of the brain. While we may not want to throw out some of these older theories, what we do want to do when we're thinking about using some of these older theories is to apply newer theories as to why we believe these intervention techniques may be working, and then utilize these newer theories as we're implementing them into physical therapy treatment. All right, so what I'd like you to do now is pull out your table, the one that's labeled Hierarchical Theory, and I want you to spend a few minutes and go through and think about how might this theory impact what is important to us when we're talking about history in in a physical therapy assessment, our examination, our physical therapy evaluation, and the intervention that we would do during therapy. So I'm going to put a little stop in the movie. I want you to stop, and after you've spent a few minutes thinking about it, come back and we will discuss some of the things that may be important based on this theory. All right, so now that you've had a chance to think about how hierarchical theory may impact what we're actually doing in the clinic, let's spend a minute and discuss or highlight some of the things that may be important. So if we're thinking about our history, what in our history is going to be important to us if we follow a hierarchical theory model? Well, anything that's going to damage the central nervous system, particularly those higher centers, and allow lower centers to take over, that's going to be something that we want to conclude or listen for while somebody's describing the history of the problem. In addition, if we're working with somebody who's younger and who may not have developed all their gross motor skills or fine motor skills, we're really listening for the poor development or periods where the higher centers did not take over for the lower centers. When we're thinking about our examination, what are the things we're going to examine? Well, we're going to examine movements maybe with keeping in mind the idea that there are reflexes strung together and that higher centers are taking over for lower centers to eliminate these reflexes. So we're going to actually look at what reflexes are present and if higher centers have taken over for lower centers to control these reflexes. In addition, if we're looking at somebody who's younger or a child, we may look at the sequence and rate of motor development, because that's going to be purely developed or determined by the maturation of the brain. So as far as our evaluation goes, if higher centers are not taking over for lower centers, or if there's a problem with higher centers taking over for lower centers due to trauma or damage, that actually is going to change our movement. So when we're looking at changes in movement or movements that are not helpful to us or limitations in movement, it's all going to be due to higher centers somehow being inhibited and not taking over for lower centers. As far as an intervention, what are we going to do? Well, just like a lot of those theories in the 1950s, 60s, and 70s, we're going to facilitate higher centers to take over as movements occurring. So we're going to look for more movements that would indicate higher centers taking over and try to facilitate these movements. and we're going to inhibit movements that we would consider controlled by lower centers of the brain. So pretty quickly after wide use of the hierarchical and reflexive model, we started looking at a theorist by the name of Walter Hess. And Walter Hess actually changed the way we started examining and thinking about movement and motor control. So he actually won the Nobel Prize in 1949, and his work was really focused on stimulating the brains in clinical in mammals. So he would actually go into the brain and stimulate parts of the brain. And when he did this stimulation, what he noticed was that the animals produced movements with postural adjustments. So at that point, he started theorizing that movement would be unsuccessful if we didn't have postural adjustments tied to them. So if we reached out our arm, but we didn't somehow adjust for our arm being out in front of us, that reach would be unsuccessful. We would actually fall over. So he started looking at movement and thinking about movement in a new way. So he started thinking about movement in what we call an outside-in approach. And this approach actually emphasizes that we look at the movement, observe the movement, analyze the movement, and then theorize about the different systems that are controlling that movement, versus examining the system itself. So in detail, like Sherrington did and the other hierarchical researchers did, they were really looking at the structure of the central nervous system and then trying to figure out how movement occurs based on that. Hess actually did the reverse. He was looking at the movement, analyzing the movement, and then theorizing about the different parts of the system that controlled that movement. So this started a new approach. And this is what we're going to be looking at in our more modern theories, this outside-in approach. So right now what you need to do is look for the third lecture and our first modern motor control theory, and that one's going to be called motor programs. So make the switch now and start looking at motor programs, and we'll continue.